Dr. Hilary, we have fantastic news on vaccinations. 50 million jabs now administered in the UK. And one of the reasons that we can look forward to finally going on holiday again. But I know you're going to say, not so sure about that.
Not so sure about that quite yet, but 15 million of the most vulnerable people vaccinated fully, and half the adult population fully vaccinated. That's an amazing achievement that the NHS and all the volunteers and people involved in that programme have been involved in. Fantastic. And it can give us confidence going forward. But, you know, new variants are still emerging and we need to be cautious. There are higher rates in Europe. Everybody wants to go on holiday. I want to go on holiday. I understand that. But I think it's right that people are expressing caution and not rushing out of a pandemic too quickly, because we don't want to be back into a situation we were in before.
Just looking at the infection rates, there is quite a difference between some of our holiday destinations. So, for instance, France, I mean, must be the biggest holiday destination with Spain. In France, we have 226 infections per 100,000 people reported in the last 7 days, compared to Spain, 110 infections per 100,000, and then Portugal, 27 infections per 100,000. So a massive difference in terms of risk.
Yeah, and just 13 per 100,000 in Barbados. That's the place to go at the moment, isn't it?
Ours is currently...
I mean, that'd be nice, wouldn't it?
Yeah, ours is currently 22.9.
Yeah, absolutely. So we look at these figures and it's easy to jump to conclusions. However, you know, how accurate is the reporting in those other countries? Is it as accurate as they are here? And it's a movable feast. It's changeable. These situations change very rapidly. Look at India, that thought it was out of the pandemic not so long ago and now in a desperate state. And that's what we need to avoid. We're in a really good place.
Their vaccination programme, despite the fact that they produce so many of the world's vaccinations, their domestic vaccination programme was nowhere near as
about
advanced.
2%, wasn't it, Adil, I think?
Yeah.
Yeah, so really low.
So, come on, from a medical point of view, do you think we should be going on holiday this year?
Well, look, I mean, what you're allowed to do and what is sensible and what is practical are all different things. I mean, I think the biggest problem at the moment will be, even if you're allowed to go, what will the queues be like at the airport? Will it take twice as long to get through?
I mean, you know, if you're going to Thailand,
you've
got to go through Dubai Airport. Dubai Airport's going to have every single nationality in that airport, isn't it? Those hubs. You know, there could be all kinds of variants.
International air travel is what brought the virus to the UK and took it around the world. So we just need to be really cautious. And people want to think that the pandemic is already over, and it isn't. It's still raging in parts of the world. And as it rages, new variants will be created and they can be brought here very quickly, which may not be susceptible to the vaccine.
Doctor, would you prescribe a summer holiday for us?
Are you saying we should...
My heart and my head are saying different things.
I can imagine.
Of course, I don't want to be a killjoy, but you know, I think we just mustn't forget.
What's your heart?
Awful.
Your heart's saying Barbados.
My heart's saying anywhere.
My heart's saying Barbados. If you're putting
saying anywhere.
Anyway, look, I understand that people have been feeling very trapped and isolated and cooped up and imprisoned. I understand that. For good reason. It saved lives. But now people want to get out and about. It's good for people's mental health. But I think to throw caution to the wind now would be a big mistake, because we don't want another
Look, I mean, for
lockdown.
lots of families, it might not even be affordable anyway. If you add the PCR test, you've got 3 kids. I mean, I thought it was about 45 quid. I heard Simon Calder tell Charlotte this morning it could be upwards of £100 per person. That's an extra £300-400.
And with that demand, I mean, you're going to get the results back in time.
Exactly.
And how are you going to transfer those results to a digital certificate or digital passport, as people are talking about? We don't know the details of that.
And also, it's so complicated because you might have had the vaccine, but your kids haven't. So then you've got to get the test for the kids. It's all very, very confusing.
That's right.
And, of course, they're not vaccinated, so they're not protected
as
well as you are from catching and then transmitting the virus.
So there are lots of hoops to be jumped through. If you really are desperate for that holiday, you just have to be prepared to sacrifice a great deal and spend a lot of time on it.
Richard, what's your heart saying?
It's less about a flying flop for me, but actually reconnecting with friends. I mean, my other half, you know, all the family is down under. That's not going to happen in the foreseeable future for a very, very long time, and that's utterly heartbreaking. Friends across the pond, of course, some friends on the continent. That is where I would love to push forward, just to see my pals. I mean, well, I turned 50, which will come as a huge shock, obviously. I mean, look at this boat. A couple of years ago...
You don't look 50.
Well,
you did once.
50. Yeah, I did once, yeah. And, you know, that was about a year and a half ago. You're right, Doc. As long as you put your hand in your pocket for that. Yeah, that was about a year and a half ago. And of course, we haven't seen each other since. So that for me is the issue. Reconnecting with pals and family.
And family, as you say, people separating from family, so heartbreaking. Which brings me to the restrictions on care homes. I mean, this is remarkable. Finally, from today, almost 500,000 care home residents are going to be allowed to go on trips outside with friends and family without having to self-isolate for 2 weeks afterwards. We've got Ruthie Henschel on a little bit later on because, you know, she's been running a campaign about having a family member allowed inside to have the sort of legal rights to be inside. We know how badly care homes were affected right at the beginning of the pandemic. But this idea that if you even went on a walk, your loved one, your elderly mother or grandmother would then have to be locked in their room on their own for 2 weeks. I mean, that seems like cruelty.
Well, the rules are relaxed now. From today, it's possible to take somebody out of their care home, take a trip in the car, go for a walk in a park or on a beach, or take them to your garden. Still not allowed to go indoors apart from using toilet facilities, but it is an easing, and it's going to be a great a relief for many families to be able to take their loved one out of the care home for a few hours.
Meanwhile, over the weekend, I don't know, Dr. Hilary, whether you got a bit itchy about this, but the thousands of people who were taking part in these events in Liverpool, I mean, an extraordinary opening up and mixing and the kind of intimacy that went on there, all parts of the government's test events to get these events back on. Meanwhile, one couple took advantage. This is, they are huge Blossoms fans. There was a gig at Sefton Park last night and Jimmy Overall decided to get down on his knee. Oh, well done, Jimmy. It's a historic moment, and thank goodness she took it in the spirit in which it was intended, and she said yes.
Amazing. Amazing. But look at those crowds. It's so strange, isn't it? Seeing so many people.
It seems like another world now, doesn't it? When you look at a scene like that and think we could be back to that soon.
Yeah. There was even an outdoor one they showed, and even then I thought, my God, what are people doing? They're crazy.
And Dr. Hilary, they did all of the testing, of course, beforehand, and then there's going to be a test in a few days' time.
Yeah, so it's an experiment, really,
will the authorities be tolerating a certain number of infections?
Yes, I think they understand that since half the adult population are now vaccinated, there's a level of protection, not 100%, of course, and it'll be interesting to see those younger people who probably haven't been vaccinated, perhaps even once. There will be a level of infection there which will infect other people.
Yeah.
However, they'll be able to keep tabs on it, see what the R rate is like, see what the results of that are in a few days' time, and be able to extrapolate from the data what's safe going forward. So, in a way, it could open up things more or it could close them down again. We'll just have to wait and see.
Yeah. And, of course, from the 17th of this month, we can go back inside to shows.
Yeah.
And, of course, the very first show to open in the West End is the longest-running show, The Mousetrap.
That's right, Mousetrap.